Good evening. I'm Sarah Jo Best with Lincoln Trail District Health Department. There are now 44 documented cases of COVID-19 within the Lincoln Trail District Health Department service area. 20 in Hardin, 7 in Nelson, 10 in Marion, 3 in Washington, 2 in Meade, and 2 in LaRue. According to projections, Kentucky will most likely reach a peak in new cases in May. It is imperative that we continue practicing physical distancing. Our staff have observed two extremes: people who are faithfully following all the guidelines and those that are not taking them seriously enough. Even the governor, during his daily updates, identifies groups that are not being good neighbors. This will result in additional mandates in response to those who continue to ignore the guidance and risk the lives of fellow Kentuckians. According to Governor Beshear, individually, we have more control during this crisis than ever before in our history. Our specific actions now will make a difference in how protected the population is. Our actions today dictate how many will be ill and need care in the next 2 weeks. Individuals can become sick anywhere from 2 to 14 days after exposure to COVID-19. We may never know how many cases of the virus are in our community. The cases reported by public health are the tip of the iceberg, since tests are limited and must be used for those most ill and for our healthcare and critical infrastructure workers. It is our duty to stay healthy at home, and we must comply. The aggressive steps taken by Governor Beshear have made an impact on the number of cases Kentucky is experiencing. As you can see, in comparison to our neighboring states, these preventative efforts have made a significant difference. In Kentucky, the increase in cases has been slower than almost all other states because the governor took quick action and most people are listening to the guidance. Kentucky reported high numbers of new cases yesterday when we saw an increase of 147 cases in a single day. In contrast, Indiana had a daily increase of 568 positive cases, and Illinois had an increase of 1,287. Strict compliance to physical distancing has the potential to save thousands of lives. The greatest impact we can have rests on how we conduct ourselves personally and collectively. On your screen is a projection of the number of people in each county who would become infected if we strictly comply with at least 3 months of social distancing measures. This graph also shows the difference in the number of potential cases if we do poor compliance with the governor's guidelines. Such a surge in cases would put a strain on the healthcare resources and can result in a large loss of life. I cannot emphasize enough that the safest place that you can be right now is at home. When we go out into public and touch surfaces that have been potentially contaminated by someone with COVID-19, we are exposing ourselves to the virus. There is much we still do not know about how long COVID-19 can survive on surfaces. However, according to one recent study, scientists found that the virus was detectable for 24 hours on cardboard and up to 2 to 3 days on plastic and stainless steel. Your chances of coming into contact with COVID-19 increase every time you touch a surface in public and every time you leave your house. When you must leave home for necessary services, only one member of your family should go out. Not only does this protect the rest of your family from possible exposure, but it helps limit the number of people at our stores. Most of our retailers are doing a really good job of implementing physical distancing measures, but the public also has to do its part. Due to the lack of testing resources and the fact that many people never exhibit symptoms, we may never know the true extent of the spread of the disease. If you are following the guidelines set forth by the governor, knowing details about cases should not change your daily behavior. We have to remember that these numbers are real people and real families. By releasing details about the age and sex of cases, it can become very easy to figure out the identity of the individual in our rural communities. Not only can this lead to stigmatizing them during an already difficult time, but it also gives people a false sense of security that if they just avoid that particular person, then they are safe. In reality, physical distancing is a very simple tool that is keeping us all safe from the spread of this disease. Let's take another look at our social distancing graph. One person infected with COVID-19 has the potential to infect over 406 people in just 30 days. Reducing your contacts by 75% drops the transmission rate to only 2.5. If you stay at home, that number could be 0. With this in mind, this weekend will bring one of our biggest challenges to date. Many people will have to rethink their usual traditions for Easter. Drive-by churches and community Easter drops, while creative, still put people at risk. Hosting extended families for gathering is too risky, and especially for our older relatives or those with chronic conditions. The rules for social distancing still have to apply to anyone not living in your immediate household. In this technological era, there are numerous ways that we can connect to loved ones that do not require being face-to-face. There are also various ways to join in worship this Easter. Many churches have been proactive and are offering services by television or online. In conclusion, please be cautious of rumors. Go to trusted sources like the governor's website, kycovid19.ky.gov, for accurate information. We are now a little over a month out from the first documented case in Kentucky. Staying healthy at home is hard, but it has the potential to save so many lives. Thank you.